which we'll be talking about is malrotation of the intestines, of course, with midgut volvulus. Volvulus is like something is tying on itself. Okay, so if something is tying on itself, over time it could actually affect the blood flow to that part of the body. Okay, so intestinal malrotation is actually one of the most dangerous neonatal and pediatric surgical emergency. So usually occurs when the intestines fail to what? Rotate normally. That's during embryonic period. The intestines, there's a whole lot of steps that the intestine takes, but this doesn't actually go as planned. So this leaves them with a narrow mesenteric base, and it predisposes them to what? Twisting on their self. So intestines twisting on their self is what is known as the volvulus. Okay, so pathophysiology is normal rotation. It said that the midgut rotates about 270 degrees counterclockwise around the superior mesenteric artery. So malrotation is there's incomplete or abnormal rotation. Okay, the midgut volvulus, we say that the small bowel is what actually twists around the superior mesenteric artery. Okay, so literally it's twisting around itself too. Do you understand? So that could actually what compromise the blood flow to the small intestine. So clinical features is for neonates, they're actually vomiting, and their vomiting is greenish. They call that the bilious vomiting. Okay, abdominal distension, irritability, shock. Okay, if they become hypovolemic, they go into hypovolemia shock. The peritonitis if the bowel necrosis occurs. In older children are having recurrent abdominal pain, malabsorption, and chronic vomiting. Alright, so diagnosis of course is occurring in the stomach, so you have to do things like plain x-rays, the upper GI contract studies. Alright, then also ultrasound. Then on ultrasound there's a specific stuff you see on imaging. That's what is known as the Whirlpool sign. Alright, so management of malrotation with midgut volvulus include intravenous fluid, because such a person could be dehydrated, NG tube decompressions, antibiotics before, because you want to prevent infections from coming in. Then the ultimate gold standard procedure or surgery is known as the LAT procedure. Okay, LAT procedure. We'll talk about the LAT procedure. Alright, so that's what we have for malrotation with midgut volvulus.